bit about Original Medicare and the 4 parts available under it. Now let's dive into Part A a little further. Part A, as a part of Original Medicare, is available to you when you're turning 65, if you're disabled, or in some cases when you have an end-stage renal or other life-threatening condition. For Part A, it's important to note that there are some costs associated depending on your eligibility. If you've worked for 10 years or 40 tax quarters, you're going to be covered at no additional cost to you for a monthly premium. If you haven't met these qualification eligibilities, you will need to qualify either through your spouse or you're going to have to pay a monthly fee. Those fees will be dependent on how long you did pay into the Medicare tax. Once you have your Part A enrolled, you're now going to have to decide whether or not you're picking up your Part B. Those decisions can be made through the help of an agent, and we can talk to you about that a little later. On Part A, you will utilize this inside of the hospital whenever your inpatient care is provided. Part A is important because it is going to be there for you when you have to be checked into a hospital, rehabilitation center, home health care center, or sometimes for hospice at end stage. For Part A, it's important to note that there are deductibles and co-insurances depending on how long you are in the hospital. These can be covered through other options that we're going to talk about further on Part C or Part Ds of Medicare. Enrolling in Part A is simple. You can go online, enroll in person at a center, or you can send in the forms to Social Security Administration. If you choose to go online, go to ssa.gov and follow the steps to join in your Medicare program. Some people will choose to defer Part A and Part B of Original Medicare because they're still working, and that's okay. You just want to make sure that you have creditable coverage at all times when you turn 65, and also make sure that your employer qualifies for you to go ahead and defer your Medicare. Additionally, if you're not receiving Social Security benefits, you're going to be ready to go for that deferral, but if you are receiving Social Security benefits, the government is going to require you to enroll. We know that this can all be confusing, and we're here to help. Give Magellan Healthcare a call so we can help you with your Part A enrollment.